Okay, my name is Lobson. We're proceeding, but sorry for not posting for that past days, but here we're proceeding about the mental health. Okay, today you are going to look about mental health, and the mental health section which you are going to look is about healthy disorder. Concerning this video, we are going to look about acute stress reaction. What is acute stress reaction? And we are going to look about the overview of stress reaction, means the causes of acute stress reaction, causes, symptoms, prevention, and the treatments. So let us start with the descriptions of acute stress reactions. And you know, acute stress reaction means ACR is equal to acute stress disorder, means psychological shock or mental shock. So by proceeding, acute stress reaction is also called the acute disorder or psychological shock or mental, but you simply can take it shock of mental. So this is a psychological condition arising in response to terrifying or traumatic events. Traumatic events are those events which you may see such harsh condition and can shock up your mental health. So this is a psychological condition arising in response to terrifying or traumatic events, or witnessing a traumatic event that can arouse a strong emotional response within the individual. Means you see someone in a bad condition and the response is where your emotional can rise. Means the rise of emotion can lead you into different perceptions or different responses. But when you look about those events, example, when you look someone events mean that someone is crying, or someone is sick, someone has fired, or someone has died, can shock your emotional. And what is going to occur is acute stress disorder or acute stress reactions. Over that, something which can embarrass your body is traumatic events, and those events is due to that they are going to rise the emotional response within your body and can lead to different consequences. But it should not be confused with the unrelated circulatory condition of shocks or hypoperfusion or a concept of shocks valves. Acute stress reaction may develop into delayed stress reaction, or better known as a PTSD, if stress isn't correctly managed. So acute stress response was first described by Walter Cannon in 1920 as a theory that animals react to threats with a general discharge of the sympathetic nervous systems. But the response was later recognized as the first stage of general adaptation of syndrome that regulates stress responses among the vertebrates and the other organisms. You know, so that is a description of the acute stress reactions. How it occur, we will see. But this is a description about the definitions of acute stress reaction. The acute stress reaction occur in the mean that someone has seen or someone has passed through traumatic events, and the among of traumatic events is death or any condition which can lead to arise the response of emotional stress. Okay, that's called traumatic events. So traumatic events lead to acute stress reaction or acute stress disorder. So here we are going to look about the common symptoms of acute stress reaction. The common acute stress reaction as follows. Common symptoms that sufferers of acute stress reaction experience are numbing, emotional detachments, muteness, derealization, depersonalization, psychogenic amnesia, continually experiencing of the events via thoughts, there is dreams, there is flashback, and the violence of any stimulation that reminds them of the events. Example, when you remember about someone or some parents are. Example, when you remember someone deaths or someone events as the action which led you to feel emotional bad, that is lead to acute stress reaction. So that can lead to acute stress reaction. As I want to explain about the acute stress reaction, that is among of suffers acute stress reaction which may lead you to see or to look someone is being affected by acute stress reaction, such as flashback of events which has been passed, or the avoidance of any stimulation that reminds you the events. Or during these times, let us continue to think about symptoms. So they must have a symptoms of an anxiety and significance impairment in at least one essential of area of functioning. So there is some part which function in your body can lead to into anxiety and significant impairments. So that is the symptoms. So symptoms lasting a minimum of 2 days and the maximum of 4 weeks, after which point continued symptoms may lead to diagnosis of PTSD. Okay, so when you talk about acute stress reaction and PTSD can lead to psych numbing, being dazed or less aware of surroundings, the realizations, the impersonalizations, and the dissociative amnesia. This is the symptoms of PTSD and the acute stress reactions, as how I have explained earlier. So acute stress disorder may be diagnosed in a patient who A. lived through a witnessed or traumatic event which they means you can see someone who has a acute stress disorder who has lived in or witnessed in a traumatic event to which they occurred. And B, the one who responded within intense of fear or helplessness, or sometimes can say horror. Someone who witnessed in intense fear is someone who can call it that has a traumatic event carrier, or the one is suffering from acute stress reactions. Okay, but another one which may detect that the one has acute stress disorder is current experiencing 3 or more of the dissociative symptoms mentioned above. Dissociative symptoms or dissociative amnesia is the one who is still keeping alone, and you keeping alone without communicating with another means there is no socialization with your neighbor, with your friends. That is a disease which can lead to acute stress reactions, means you keep away from your fellows. So acute stress disorder, abbreviated from ASD, means A is acute, S is stress, D is disorder, and not to be confused with the autism spectrum disorder. Okay, there is acute stress disorder and the autism spectrum disorder. That things are very different. So in the result of traumatic events, that is, we call it acute stress disorder. That's disorder which occurred due to someone has passed through traumatic event. So traumatic events lead to acute stress disorder. So you can see that the acute stress disorder is the result of a traumatic event in which the person experienced or witnessed an event that caused the victims or witness to experience extreme, disturbing, or unexpected fear or stress or pains, and that is involved the thickness or serious injury, perceived serious injury or death to themselves of someone else, or study of ratio person after exposure to a traumatic event showed or no gender difference in acute stress reaction, or acute stress reaction is a variation of post-traumatic stress disorder. That is the explanation of stress disorder. But how? What are the causes? And how can we prevent it? And how can we treat it? Means the disease which is caused by traumatic events, such as injury, such as someone has fired, such as nabbing, such as derealization, such as dissociative amnesia. So let us proceed about looking the causes, symptoms, prevention and treatments about these acute stress reactions. So the acute stress reaction, one can see that the causes of this mental disorder is so tough, but its causes is about experiencing or witnessing a being confronted with one or more traumatic events that cause SD. Okay, the events create intense fear or harass or helplessness, and that events, which is called traumatic events, can cause acute stress disorder, are including death, experiencing someone is dying, that cause the rising of emotional response. Okay, another one is the threat or death of oneself or others. Threat of death means you meet with a challenge which can lead you into death, or you meet with the challenge which can lead you into another death. Means that challenge will increase you into emotional disorder. But another threat is the serious of injury to oneself or others. Serious injury, like firing of your house, that is an injury, or any injury which can lead you or can threat you into death, like when someone cuts her leg or his leg, or when someone is playing a football and get an injury, or when you're riding a bicycle and get an injury. That is serious injury to oneself. Okay, or maybe result to the serious injury of another one, or you are calling, that can lead to the rise of emotional feeling response. Okay, and that if can lead to emotional feeling response is where you can determine that can lead to acute stress disorder, or it can create emotional disorder. And the another causes is related to physical integrity of oneself or others. Physical integrity means when you are doing something, as we know that integrity is doing something even though you have not been told, means they take responsibility even though someone is not care about. But you know that you can meet with the physical integrity challenge, which can lead you to witness something which is difficult. And when you talk about threats to the physical integrity of oneself, you do something even though you have not been told to do such things, but such things can lead you to meet with the challenge. And that challenge may raise the emotional response disorder, and that emotional response disorder will lead to acute stress disorder. The acute stress disorder is where you are going to be affected in psychological responses, because when you talk about the physical integrity of oneself, threats or challenges, that's what will realize the emotional response feelings. And when you get about the emotional response feelings is where you are going to be affected in psychological minds. That is the causes of acute stress disorder, which is a death, threats of death or experiencing others, threats of serious injury to oneself or others, threats to physical integrity or oneself or others. That is causes of acute stress disorder or emotional stress disorder. So let us see another one, which is synonyms. Synonyms is dissociative synonyms. First, when you talk about dissociative synonyms, is where you will have 3 or more of the following dissociative synonyms. Means that when you talk about dissociative synonyms, is where we recognize you that you are in that case when you have this one: feeling numb, detached or being ecological responsive, or being reduced the awareness of your surroundings. As we talked earlier, dissociative synonyms: to be aware or to reduce awareness of your surroundings, or depersonalizations or dissociatives of amnesia. That is called the dissociative synonyms. But another is re-experiencing the traumatic events. Someone is re-experiencing about the traumatic events, such as having a recurring image, thoughts, nightmares, illusions, flashbacks, episodes of traumatic events. Some people are like seeing about seasons, movies, and that movie may contain traumatic events which can lead and still ride in your body feelings, and that is going to be a problem, because when you talk about some things which is riding your body feelings, you will feel that every single kind that moment which can affect your body, so that body will be affected emotionally. So be aware of that. Any revising or reviving the traumatic events, or feeling distressed when something reminds of your traumatic events. And the another is the avoidance. So someone, you may avoid stimuli that cause you to remember or experience the traumatic events. You may avoid the people. Means that someone is your enemy, and when you meet with someone who has caused anything to your body or anything to your life, you will remember something that will rise the emotional of traumatic events. Means when you will the response of that will lead you into traumatic events, and that will increase the emotional response to that one. That is avoidance of people. Mean that people is your enemy, and when you meet your enemy, you remember what someone done or did for you. And the another synonyms is conversations. Here the synonyms of conversation with someone who has has met with traumatic events, or with someone who has acute stress disorder, is someone in conversation may take a little bit of speaking, or may not speak, or may feel shy in speaking in front of others or in front of the majorities. That is conversations. But places, another is places. In avoidance of places, someone will still avoiding the place. Someone may not socialize with others into a various spaces because feeling of shyness or feeling of being alone. Okay, something which is avoided is objectives. Objectives are being avoided due to that someone is feeling inferior, someone cannot join with others, and someone cannot take an opportunity of doing something which is not for someone else. And the other is the activities. The one is still avoiding activities, which is very crucial and which can lead to an economic advantages, but the one is affected. He or she does not know what to do in such activities, and he or she, even though the one might have any professional skills about that activity which is being done, but is not aware about the time to do that things and the time to respect for that activities and the effort to input in that activities which might be done in allocated times. So someone tend to avoid activities. The one is not responsible for doing certain activities. And the another symptoms is avoiding thoughts and feelings. Someone is not about awareing thoughts or feelings. Means when you feel, you get thoughts, and when you thoughts, you can get an idea. And when you are less in feelings, but I'm not talking about feelings of things which you have done for leisure. I'm talking about feelings which lead to traumatic events, and that traumatic events which are going to raise your emotional response, where I'm talking. So symptoms of this one is someone can avoid people, conversation, places, object, activities, thoughts, and feelings. That is a symptoms. As I talked there earlier, by summarizing the symptoms here is about the overview of this one is the dissociative symptoms, the expressing the traumatic events, avoidance, and the avoidance. So you can see that is a symptoms. But let us look about the preventions. The preventions means when we talk about prevention of acute stress disorder, mean that this acute stress disorder has not already passed it to someone. Means here we are preventing someone to get emotional stress disorder. We are preventing someone to get emotional stress disorder. So here we are getting preventions. So because there is no to ensure that you never experienced any traumatic situations, or you have experienced any traumatic situations, no one can ensure that that condition has passed into your lives. No one. So there's no way to prevent emotional feelings, or there's no way to prevent that acute stress disorder is not being your part. Someone or some other people are being affected by different things which extends in their lives. So there are other things that can be done to reduce your likelihood of developing emotional stress disorder. Or the only way here we can do is about reducing the prevention, because there is no one who experienced your life. There is no one who saw you are passing in your life, where you pass, what you did in your life. So about traumatic events, there's no one is aware in your traumatic event. So there is a way of reducing but not preventing. So the only way of reducing or preventing about emotional stress disorder is getting medical treatments within a few hours of experiencing traumatic events. Example, you have seen someone is dying, or you have seen an injury occurring in the roads when you are traveling. In order to reduce the emotional feelings or the rising of emotional things which can lead you into a disorder, we have to take you into medical treatments. Okay, that is a prevention, and that medical treatments can be taken within a few hours, means 2 to 5 hours. 2 to 5 hours. Over that time you are experiencing a traumatic event, means you have seen someone injured, and for sure the rising of emotional disorder has been raised. So the only thing here we can do is about taking medical treatments within a few hours. Okay, so in taking that, we are going to reduce the emotional feelings of traumatic events. So this may reduce the likelihood that you will develop any emotional stress disorder. So people who work in jobs that carry a high risk of traumatic events, such as military personnel, may benefit from preparation and training and counseling to reduce their risk of developing acute stress disorder or emotional stress disorder, or at some time you can say that is pre-stress traumatic disorder or PSTD. If a traumatic event does not occur, there's no problems, but if in that area, example in military techniques trainings, there is many traumatic event which is occurring, or in playing football, or in riding a competitions lens, there is many traumatic events which occur, and that's who are preparing that events because they experiences someone or many of people who are passing that situations. That one, or we can say that is a professional or a professional in preparing the materials which can be used in training and counseling to reduce the risk of developing acute or emotional stress disorder, because is being aware to ensure that the experience of traumatic situation is occur in which place to somebody, or at what area to somebody, at what age of life to somebody, and any other condition which can be used to secure that one who has passed any traumatic events. And so you can hear that preparation, training, and counseling may involve fake enactments of traumatic events and counseling to strengthen and coping mechanisms. If you are not aware about this, don't do for prevention. If you're not aware about the preparation and the training of counseling of this one, don't do, because you are going to affect someone else. If you are aware, do. And the one who is aware, who has been suggested by scientists, is medical treatment taker and the military personnel. That is who still coming with the knowledge of treat someone who is stressed with the disorder, and someone who taking psychological disorder educations is the one who can be aware of this one. Example, there is a tendency for schooling boys and girls to have some disorders of this one, but the one who is responsible for doing such things is the teacher, because teacher is the one who spend a lot of time by looking the lifestyle of that students. So if the student is feeling bad or has passed into several disorders or emotional disorders, the one who's responsible over there is teacher, about looking the continuing of students' progress, and the one is parent, because the parents has a chance of having a time with the boy or girl or her child, is the one who is responsible. So you can see here that the one who is responsible for students' stress disorder is teacher, and the parents and the medical treatment taker. But the one who is responsible in military trainings is military personnel, is the one who can take prevention about reducing the causes of traumatic disorder. So if you have been affected with this such acute stress disorder or emotional stress disorder, you can look about someone who has education or professional trainings in medical treatments. That is overall. Generally, see the medical treatment trainer or medical treatment taker, is the one who can save you scientifically and psychologically. Take your psychological therapist to treat you, means to give you some advice concerned to what you feel. But if it is not possible, take for yourself with the socializations about expressing your problems, and the one or your calling can save you, because many of us, we are stealing our problems, means we are not discover our problems to others, we are not taking our problem to others, we are still having a problem and we don't express ourselves. As you express yourselves is why you will be saved. Okay, about looking or overlooking of preventions, let us proceed in looking treatments. But let me differentiate the treatments and the preventions. Prevention, you are prevent something to occur, but treatment, you treat something which has been occurred. Okay, when you talk about the treatments of this stress disorder, means already you have a stress disorder, but how we are going to prevent it and how we are going to treat it. So when you talk about the treatments, how we are going to treat someone who has been already affected with the stress emotional disorder. But when you talk about the preventions, we prevent someone to get emotional disorder. That is difference. So let us see about the treatments. Here, by seeing overview of this one, treatments is go directly to doctor. So your doctor may use one or more of the following method to ensure that he or she treat you over stress disorder emotionally. So the acute state stress disorder emotionally can be treated as follows. Why we are taking a doctor? Doctor is the one who has a professional medical education or professional medical treatments. Is the one who is professional generally, because the one know the psychological of someone who is emotionally feeling bad or emotional looking bad, is the one who is very, very close with this one. So the only thing you can do is about take one or take your body or take someone to a doctor. So the doctor can use the followings if you are going to take that advice or to take that treatments over prevention. Is the one can take or can be leading or driving over these following reasons, which can lead you to secure your life or your mental health. The issue is to secure mental health. After getting the traumatic events, make sure that you visit to a doctor and the doctor will use the following ways to ensure that your health condition is still being in good lines. So the doctor will use something which is psychiatric evaluations to determine your specific needs. Means doctor is going to use psychiatric evaluation to determine what your specific needs, what is affecting you, what is still being a problem to your body. The doctor must do evaluation, and the evaluation can take a time because doctor must live with you so as to see your tendency of experiencing in lifestyle. It means to know your needs and to know your behavior. So after knowing your behavior, the doctor will be able to evaluate you in terms of social, psychological mindsets, so that one can be aware with what is being affected or what is your infection into your body. That is. And another one is hospitalization if you are at risk suicide or harming others. Someone is feeling suicide after having a traumatic event, emotionally disorder. Someone feeling to kill herself or himself. Don't do that, because here you are going to be treated good, because someone is taking the evaluation of your body, the evaluation of what can be done in that moment. So don't take this, because it is going to be a problem. Don't take the risk of harming yourselves. Don't take the risk of suicide your body, or don't take the risk of harming others. It is a problem. So the only one thing which can be done about treat is the one who has suicide feelings, and the one who can harm others is hospitalizations. Okay, when you talk about hospitalization, is coming together feelings of someone and disputes or filter the feelings of someone who has the ideas of having suicide or harming others. You are hospitals of those feelings, means you're doing hospitalization. And over hospitalization is something which is going to rescue your mindset, psychological and other feelings which can be affect your body. Another one is assistance in obtaining shelter, food, clothing, and locating families if necessary. Okay, you can locate families somewhere where might be done in order to rescue your body, feelings and mindsets. And another treatment is education to teach you about your disorder. You must know your disorder so that you can be aware what you do. You can be aware about harming others. You can be aware about harming yourselves. So you can get the educations concerned to the problems you have, to the problems about others, and how to take it to others. And another treatment is medications to relieve symptoms of emotional stress disorder, such as anxiety medications, selective scrotum reuptake inhibitors, and antidepressants. Antidepressant is the one which is going to rescue our mindsets and feelings about traumatic events which occur into your body. Another treatment is cognitive behavioral therapy, means CBT. C, cognitive behavioral, stand for B, and the T stand for therapy. So another treatment is cognitive behavioral therapy, which may increase recovery speed and preventing acute stress disorder from turning into PTSD. When I talk about PTSD, is pre-traumatic stress disorder. This is a condition which you meet before having a stress or acute stress disorder. The first part here, or the first events which occur to your body, is PTSD before ASD, means you must pass into previous traumatic stress disorder before acute stress disorder. So something which you can take is cognitive behavioral symptoms. And another one is exposure-based therapies. The exposure-based therapies can be the best treatments to your body in order to avoid about acute stress disorder. So another one is hypnotherapy. The hypnotherapy is going to treat you about acute stress disorder. About being so, be aware about treatments, prevention, symptoms, causes, and the descriptions of acute stress disorder. Why? Because you are going to be aware about traumatic events. When they occur, you are not going to raise your emotional feelings. So if you are not going to raise your emotional feelings in some way, you are going to be aware about the traumatic events, feelings, license, and then you are going to be aware about something which can occur to your body, to be safe about suicide or harming others or harming yourselves. You are going to be aware about those disorders, because the reduction of feelings or emotional disorder has been reduced by medication or doctor evaluations, or hospitalizations, or medications, or cognitive behavior therapies. So about this video, you are not regret. You are going to obscure something which affects your body. You are going to discover a lot of things, and even hospitality of doing some things, and even about encouraging someone who pass into different condition, about affecting their body, about doing something which is not good in the family, about something which is going to harm others. So you are going to encourage someone to live over that, about the risk of suicide or harming others or harming oneself or herself life. So please subscribe this YouTube channel. The video is still in the morning, so we are going to explore a lot of things in this YouTube channel as how it is. So thanks, subscribe our YouTube channel. Thanks. We're gonna meet other sessions.